This is an overview of the JBSA San Antonio Military Health System. In this briefing, we will focus on services found here at Lackland at the 59th Medical Wing or Wilford Hall Ambulatory Surgical Center, but these services are offered throughout Joint Base San Antonio. There are three main military installations in the San Antonio area. They are JBSA Lackland, JBSA Fort Sam Houston, and JBSA Randolph. Each base has primary care clinics. There are also outlying primary care clinics around the city. For example, Camp Bullis, Gateway Bulverde Medical Home, and Westover Hills Medical Home. Fort Sam Houston has the only military hospital, San Antonio Military Medical Center, or SAMC. As a Level 1 trauma center, SAMC treats patients of all ages to include active duty, retirees, reservists, and family members. Active duty members will be enrolled in a clinic closest to their duty location. Family members will be enrolled to the clinic closest to their home zip code. Family members can choose to be enrolled to any clinic, but must specify when signing up with TRICARE. Most medical services are available here at Lackland as a one-stop shop. We hope you choose Lackland as your clinic. In today's briefing, we will discuss prevention, access to your primary care clinic and provider specialists, HIPAA, and elective care. The San Antonio Military Health System provides an array of services, including specialty care. Your PCM will need to place a referral on your behalf to see a specialist. Rarely will referrals be made to off-base providers. If you need a referral, please make an appointment with your PCM as soon as you can. All active duty members are required to track and complete medical requirements in a timely manner. Your preventative medical requirements for readiness will include staying up to date on your vision, dental, immunizations, labs, colonoscopies, mammograms, and PAPs. Refer to ASIMS for IMR dates. If you are PRP or carry a weapon as part of your duties, please tell the front desk clerks and your PCM. This designation is important to know for diagnostic and treatment purposes. For deployment health, separation history and physicals, occupational health and PHA-related needs, you will visit the Base Operational Medicine Clinic, otherwise known as BOMC. BOMC is in the Reed Clinic, located at 1940 Carswell Street on the training side of the base. If you are on flying status, you will be assigned to flight medicine, also located in the Reed Clinic. Your spouse and adult-dependent children can be enrolled with you in flight medicine, but you must specifically request that placement when you enroll with TRICARE. HIPAA is the Health Insurance Portability and Accountability Act. So what does that mean for you? It means that your health information is private and protected. Only individuals who need to know will have access to your medical information. This number, 210-916-9900, is for the Central Appointment Management Office known as CAMO. Save this number to your phone. Use this number to make or cancel an appointment. Request medication refills. Ask for a referral or check on its status. Ask your PCM a question, or for any other reason you need to get in touch with your PCM team. If you need to cancel an appointment, please call at least 2 hours beforehand so that someone else can be booked into that time. Please allow at least 3 to 5 days after your PCM places a referral before you call and check on its status. CAMO is open from 0630 to 1630 on duty days. For after-hours care or questions, there are menu options that will direct you to the nurse advice line. If playing phone tag is not your style, there is another option. The TRICARE Online Patient Portal is an encrypted and secure site and is available 24/7, 365. You will have access to this portal from your home computer, tablet, or smartphone. Your personal home email address, such as your Gmail, Hotmail, or Yahoo, is needed for you to receive your first invitation to use secure messaging. Do not give us your mail.mil address or you will need a CAC card to log in. Check your junk email for your first invitation to secure messaging. With this patient portal, you can book and cancel appointments, request medication refills, review lab results, send a secure message to your provider, and more. You can create your profile and track all of your health services. By using secure messaging, the two-way communication between you and your PCM team will become part of your medical record for you to review at any time. If you use the secure messaging app within the patient portal, your PCM team will respond to you within 1 duty day. Our focus here is on prevention for you and your family. We offer well child visits, sexually transmitted infection screenings, immunizations, lab studies, and other health screenings. Active duty members and their family are generally assigned to a family health clinic. Here at Wolford Hall, the clinic is located on the first floor A wing and accepts patients from 2 years of age and over. Family Health is an appointment-based clinic and accepts limited walk-ins from 0900 to 1100 hours and 1300 to 1500 hours. For these walk-ins, you will see a medical technician or a nurse using support staff protocols. These protocols cover swabbing a sore throat, screening for urinary tract infections, pregnancy tests, suture removals, and Depo-Provera injections. Other health concerns will require an appointment with your PCM. If you are ill, your leadership can grant you one-day quarters. If there is no improvement in your condition, please call to schedule a PCM appointment or report to the Family Emergency Center. You may enroll your children aged newborn to 23 years into the pediatric clinic. The pediatric clinic is located on the first floor D wing. Parents can create a secure message account to communicate with their child's or children's pediatric team. The clinic has limited walk-in services that include sore throat swabs, suture removals, head lice inspections, sexually transmitted infection screening, and Depo-Provera injections. Please ensure your child or children visits their PCM for scheduled wellness checks and immunizations. If you have a child that will be playing sports in Texas, they are required to have their sports physical paperwork completed prior to participating. Book these appointments as soon as you can once arriving. Be proactive and book the next year's appointment as early in the summer as possible because these appointments fill quickly. A physical is not required to attend public schools. Please check with your private school or daycare policy. There are several pharmacies on base. Mail order pharmacy service is also available. If you are arriving from another base with medications that have refills remaining on the bottle, those refills will be honored here. You must bring the bottles to the Wolford Hall Ambulatory Surgical Center Pharmacy to have your meds refilled. If you arrive here needing medication and you have 0 refills remaining, you may be able to get a courtesy refill to last long enough to see your PCM. It takes the pharmacy 3 duty days to process refills, so ensure you request your refills or renewals at least 5 days in advance to avoid running out. There will be no refills on controlled medications. Primary and ancillary clinics at the Wolford Hall Ambulatory Surgical Center have limited services on the last Wednesday of the month. The Family Emergency Center will remain open for urgent health needs. If you need to contact your PCM team, call CAMO or send a secure message via the TRICARE online patient portal. Please check with your clinic if you have any questions. If a health concern arises after hours and you are unsure what to do, call the Nurse Advice Line at 1-800-TRICARE or 210-916-9900 and follow the prompts. You will speak to a registered nurse who will ask you questions and provide the best recommendations for your condition. The nurse may provide you with instructions for home care or prompt you to seek urgent or emergent care. If you are directed to go to an emergency room, please seek care immediately at the nearest ER. You do not have to drive to SAMC. Avoid off-base family emergency centers, as they might not be covered by TRICARE. How do you know if you need to go to the FEC or an ER? An emergency is defined as a threat to life, limb, or eyesight. FEC age criteria, birth and above. Lackland has a freestanding family emergency center. Freestanding emergency centers differ from traditional emergency centers. For example, SAMC ER, because they are not connected to a hospital. The Family Emergency Center at Lackland is well equipped to handle most common acute illnesses and minor emergency conditions. Those conditions include head, chest, and stomach pain, fractured, sprained, or broken bones, shortness of breath, vomiting, dehydration, fever, or sore throat. However, a person experiencing signs and symptoms of a stroke, heart attack, or other life-threatening illness, a call to 911 should be made immediately or report to the nearest emergency facility immediately. Avoid driving yourself. If you're active duty traveling out of area, please make sure you call TRICARE to get a referral for any family emergency center visits. If you are considering elective surgery, call to speak to a benefits counselor. You need the appropriate referrals and permission from your chain of command for convalescent leave. Do not seek elective care from off-base providers without authorization. Any complications that arise and affect your readiness is cause for disciplinary measures, and you may be responsible for paying for any medical care related to complications from unauthorized procedures. All active duty members and their families can receive eye examinations in optometry. Only active duty can receive their glasses or contacts. Family members must get their glasses at an off-base or online site. For LASIK or PRK, active duty must have a referral from optometry. Flight crews must obtain their application from Flight Medicine. Family members who wish to have LASIK or PRK must fill out a request packet and will only be accepted on a case-by-case basis. Please visit the ophthalmology department for more information. The dental clinics located on Lackland provide an array of services for active duty. The Dunn Dental Clinic, Air Force Postgraduate Dental School, and Woolford Hall Ambulatory Surgical Center Dental Clinic accept eligible family members on a case-by-case basis based on a referral from the civilian dentist. Please check with them for more information. Outpatient Records Department is located on the first floor C wing of Woolford Hall Ambulatory Surgical Center. When initiating a request for copies of medical records, please allow 4 to 6 weeks for pickup. Active duty members who carry their records under special circumstances should deliver them to Outpatient Records. Members on flying status should deliver their records to Flight Medicine. Woolford Hall is now housed in a beautiful new building. Maps, help desks, and information kiosks are located throughout the facility. Lackland has several fitness centers that provide a variety of amenities. We are striving for the perfect patient experience, and your feedback is the most important aspect of our efforts. After your visit, please fill out a paper comment card or go online and fill out an electronic survey. There is information in your packet about the interactive customer survey site. Tell us what we're doing right and where we can improve. We value your opinion and read every single comment card we receive. For general information about Woolford Hall Ambulatory Surgical Center, please call 210-292-7412. There is a medical management member here to answer any questions you have. Thank you, and welcome to San Antonio.